All right, I think we can get started now. We have a good amount of people join the call. Good afternoon, everyone. On behalf of the Institute for Health Equity Research Community Engagement team, we'd like to welcome you to our bi-monthly virtual seminar series. The seminar will provide an opportunity to learn the basics about community-engaged research methods, hear from others about their experiences, and consider how you might build community-engaged practices into your research. Today we'll be hearing about some of the many available community-engaged research approaches, along with the examples of project-specific examples that use these approaches. We'll have a great panel discussion followed by Q&A. Our moderator today will be Gedi Arniela. Gedi Arniela is the Director of Community Health and Outreach and a faculty member of the Harlem Family Medicine Residency Training Program. She's been a co-PI on numerous NIH and CDC grants and is currently working on the New York Community Engagement Alliance, a national initiative and an NIH grant, along with NYU, team members here at Mount Sinai, and multiple community-based organizations. And without further ado, I'll give it to Gedi now.
Thank you, Timnit. Good afternoon, everyone. It's great to have you all join us today. Today's panelists have over 20 years of experience in community-engaged research, and we're grateful to have them with us today to share their expertise. I'm going to introduce our four panelists. First, Dr. Nita Vangipuram is an associate professor in the departments of pediatrics and population health science and policy, and is associate director of the community engagement core of the Institute for Health Equity Research at Mount Sinai. Next, Crispin Goitia is the engagement program manager for the Institute of Health Equity Research and the principal investigator for the Insight Data Network with over 20 years of experience in engagement. Devin Madden, sorry, I'm like a little tongue twisted today. Devin Madden splits her time between the Office of Gender Equity and Science and Medicine and the Institute for Health Equity Research here at Mount Sinai, and is currently pursuing their PhD in Education and Leadership. And finally, Reverend Dr. Mimsy Robinson serves as an associate pastor of Bethel Gospel Assembly in East Harlem. He has been a stakeholder on the teams of several research projects over the past 20 years. As we prepared for this presentation, we realized that besides community-engaged research, we all began doing this work because of Dr. Barbara Brenner. Dr. Brenner was the Director of Community Relations at Mount Sinai and was a pioneer for community engagement here for over 30 years, partnering directly with community organizations to deliver health services and education tailored to the needs of East Harlem residents. Barbara served as a role model and mentor to so many who are now committed to carrying on her legacy of combating health inequities in our Black and Brown communities and furthering CER. We want to dedicate this series to Dr. Brenner. We ask that you drop your questions in the chat and we can have a discussion at the end of the presentations in our Q&A session. Each panelist will have 8 minutes to share with us, and then at the end, we will open it up for discussion. Thank you. Oh, Dr. Nita is going to start first.
Thanks, Gedi, and good afternoon, everyone. We're really excited about this seminar series that we're launching today and hope that you'll all join us for future sessions. We'll be meeting every other month. And today, I'm just going to give a brief introduction to a specific community engaged research method called participatory action research. You can go to the next slide, please. So participatory action research, or PAR, there are a lot of definitions, but pretty standard guiding principles across those. Most importantly, it involves researchers and stakeholders working together to understand a specific problem or challenge in their community. and then to use research and data to figure out how to affect change and to address that problem. It is a context-specific approach, meaning it focuses on a particular neighborhood, community, or geographic region. It also targets the needs of specific or particular groups, which could be racial ethnic groups, age groups, gender groups, or others. The approach involves iterative cycles of research, reflection, and action, which I'll show you a little bit more about in the next slide. And importantly, it empowers individuals to really use data to address inequities that they face in their daily lives. And the approach also uses a range of methods, including both quantitative and qualitative research. Next, please. So one specific version of participatory action research is YPAR, Youth Participatory Action Research, which is a youth-centered form of PAR, and it aims to increase the power of marginalized youth, engaging them as co-researchers so they think about their own day-to-day lives, identify a challenge or problem that they're facing, and then design research to collect data to figure out how to address that problem. And it aims to integrate the perspectives and experiences of youth who may often be overlooked in this type of work, as their perspectives are obviously very important in addressing health inequities, and the ultimate goal is to achieve equity. And on the right, you'll see a visual of an overview of the approach. So at the top, it starts by identifying a topic area of interest for the research, and then the young people help collect the data and then analyze the data and reflect on the results to actually inform a plan of action based on the findings, and then implement that action, and then disseminate findings and assess the process and outcomes. And then the cycle is repeated iteratively to kind of, move closer to the ultimate goal of addressing whichever problem they identified and moving closer to equity. Next. So YPAR historically has been used mostly in developing educational programs and addressing issues of social inequities, but has been used more recently in developing health interventions, especially related to health promotion. And so in the next couple of slides, I'm going to be giving just a very brief case study of our use of YPAR in a particular study, Teen HEED, where HEED stands for Help Educate to Eliminate Diabetes. And I just want to give a shout out to Getty and Reverend Mimsy, who've been involved with this study from the very beginning. And the project grew basically from recognition of the increasing prevalence of type 2 diabetes and prediabetes among youth. And the chart on the bottom there shows that there's a disproportionate burden of these conditions in youth of color. And we see high rates of diabetes in our local community of East Harlem, and definitely worry about our kids going forward in the future and keeping them healthy. And there are unfortunately few proven effective diabetes prevention programs, especially for young people. And so when youth and youth advocates in East Harlem heard about this emerging epidemic, they really got inspired and mobilized to try to address this problem. And they began in collaboration with our research team in developing focus groups to really learn about what people know about diabetes, the sort of things that make it harder and easier to have healthy lifestyle behaviors. And we used all of this data to develop a conceptual model for an intervention program, and then did further qualitative work to really identify key themes to guide program development. Next, please. And so the youth basically adapted an effective adult diabetes prevention program, which used peer leaders who were trained to deliver a group workshop. And the youth in our, the youth partners that we worked with were really instrumental in shaping all of the program activities. And these are just a few of the things that they brought in sort of emphasize the importance of using interactive activities like games and role play to teach key concepts as opposed to just getting lectured to, which they get enough of at school. Addressing social pressures that they might face from friends and family that may lead to unhealthy behaviors. And interestingly, what really came out in some of our meetings with them was an emphasis on youth autonomy and really giving them the ownership of their own lifestyle and health, separate from their parents and caregivers. They also talked about the importance of media on body image and weight-related stigma, which is growing and growing with social media. And also really emphasize the importance of stress, emotions, and mental well-being on health. And we've really increased some of those topics in our curriculum because of their input. And finally, really stress the importance of youth empowerment and sort of equipping young people with the skills and knowledge that they need to not only make changes for themselves and their own health, but to help others in their community, peers that may be going through the same challenges, and sort of advocating for school level, community level, neighborhood level changes that they can help support to keep everybody healthy. Next, please. Next slide, please. And so in addition to shaping the actual intervention curriculum, the young people were involved in every aspect of the study. They helped shape all the recruitment, retention, data collection, and evaluation for the study. In terms of recruitment, they proposed recruitment sites, including schools and community organizations that serve young people in the community. They helped design recruitment materials, including engaging flyers with slogans and graphics that they chose, as well as design colorful bracelets with the study name and logo. They recommended that we use innovative and engaging strategies to pull other young people into the research, using things like storytelling, sharing about friends or family or others that they know that have been personally affected by diabetes, to really encourage other young people to get involved. And they also really importantly encouraged strong relationships between the study participants and the study team, including myself as the head researcher, as well as all of our study staff, to really sustain trust and buy-in throughout the course of the study. And in terms of data collection, they emphasized that we should have young staff and volunteers lead the data collection efforts, and that this really would increase the study participants' comfort level in terms of, getting their assessments done. They also informed our survey and advocated for it being short to kind of minimize the burden on the participants, and really helped vet materials that we use to give information back to the participants about their health in a way that was more understandable to them and that decreased any stigma around weight. Next, please. They also were really instrumental and pretty much designed the entire text messaging component of our intervention. They used focus group results to actually develop the message content, and pilot tested the text messaging program several times to give feedback and refine it. And this ended up leading to a really innovative and cool triple partnership between the young people, the researchers, and the tech industry partners that we're working with on this to move the work forward. And all of this, I'm not presenting detailed information about our study findings, but we were able to achieve some preliminary findings that showed stabilization of body measurements and decrease in metabolic risk for the young people that took part in the intervention, which is really exciting. And the coolest part is that using this YPAR approach really allowed us to achieve these results, even though we had a pretty modest study budget and team, and even though the intervention was not clinic-based, so not delivered by healthcare professionals, not family-based, so didn't require a lot of parental involvement, and definitely was less intense and lower dose, so not as many intensive sessions as other published interventions. So maybe an intervention that is more likely to be sustainable in communities like East Harlem. And we credit that to the YPAR approach we use. Next, please. And then just really quick, I'd like to just highlight a really great resource from Berkeley called the YPAR Hub, which has materials, like adaptable curriculum that can equip young people with the skills and knowledge that they need to do this type of research. There's also a lot of articles that I'm happy to share. And of course, I'm happy to talk offline with anybody who wants to learn more about this community engaged research approach or the study. And with that, I'm going to pass it along to Crispin, who's going to be talking about the accelerator model for engagement.
Hi, welcome everyone. Thank you again for joining us this afternoon. And I will be speaking to you today about the accelerator model for engagement. Next slide, please. So I actually took this from another presentation that I had worked with some stakeholders to come through with, and looking at how the stakeholder research footprint, and to really be proud of the steps that you take, because they're definitely going to take you places. And that's kind of what I'll describe with our accelerator model and an example of that engagement strategy. Next slide. So here's our model for our stakeholder engagement research, the accelerator model structure. And so if you see in the middle, you have the term accelerator. I know often people hear accelerator, they're not sure what that really means. In this situation, it's really accelerating and being able to rapidly address research concerns, research ideas, programmatic efforts, and grant submissions to really think about a problem, have community members, patients, caregivers, researchers, healthcare professionals, public health policymakers, industry funders, and other groups that may not be listed here, and really identify a community concern, have ideas and questions, challenges, and often have been siloed and kind of separate from one another. And so to take a step back for a second, the traditional model of community action boards is where we started off with, and realized that people really needed to come together around things that were interesting to them and they were passionate about, and being able to make that matchmaking process happen. And so that's how this model evolved. And then using those concerns and making an impact, maybe generating new ideas, generating new questions from what we worked on together, definitely building trust, which is something you'll hear throughout all the presentations, but definitely extremely important. Looking at health system change. What's the community benefit? What are the program and policy changes, whether it's on a small scale or large scale, that we can do together? And an exportable accelerator system that has been used time over. Next slide. So here's the accelerator model. It's a framework that provides a platform for diverse stakeholders, which I just mentioned. Each accelerator team is topic specific, pairing all of the different stakeholders with accelerators that focus on areas related to their lived experience, to their passion, to what's important to them. And accelerators share topic-specific guidance, information, often educational resources to foster a really co-learning collaborative amongst our stakeholders. Next slide. Why the accelerator model? As I mentioned in the first part of my presentation, that we had the community action board model, but all of our stakeholders are incredibly busy, and we realized that we needed to match people with what really mattered to them. And so the need to evolve our engagement strategy really is why the accelerator model became very important for us, to help facilitate pivoting the needs of various research projects and programs that come to our desk or to our email. And it's very different from a community advisory board for that reason, because it tends to change. If you can go back a slide, I'm sorry. And it's a really great organizing principle and framework to help your entire project or initiative, so that you really think about all the diverse people who should really be part of all of that, to help inform all aspects of the work. Next slide, please. And so here's a really great example of stakeholder engagement. We have our Medicaid Health Home Project. And just to give you some background, the project was focusing on patients, care managers, and researchers and health home leaders to really understand the patient and provider experiences for patients that were in the Medicaid Health Home Program in New York State. And we focused an accelerated team focused on diabetes and chronic kidney disease, with different people from different parts of health systems, not just Mount Sinai, but working with Montefiore, Cornell, and with patient providers. that were individual to communities that were not affiliated with a particular institution. And some of the accelerator team activities that were really important is that we collaborated with patients and stakeholders from different community organizations to understand prescribing patterns of providers who treated patients with type 2 diabetes. The patients and all the stakeholders in the accelerator developed focus group guides, personal interview guides. When COVID happened, we were in the process of doing in-person focus groups and quickly had to pivot to a virtual environment like so many of our colleagues. And in doing that, our stakeholders, our accelerator stakeholders, were really amazing at coming together and deciding what platform should we use. Would it be better to do personal interviews over focus groups if we're not able to reach the groups that we're trying to reach, to really be cognizant of the fact that people's lives really changed and needed to pivot in that moment. And they were amazing in being able to get that done. And also created a list of outcomes from our data repository to really look back and say, are these the outcomes? Are these the things that we should really be looking at? Next slide, please. And here's another example of stakeholder engagement. And this was not a research project. So the Trust for Public Land came to colleagues here at Mount Sinai and asked us, we really want to work with a healthcare system to put fitness zones in. We've been doing them in other neighborhoods across the country. We really think it would be beneficial to work with Mount Sinai and other groups. And so after some years of working together, Mount Sinai, New York City Housing Authority, Trust for Public Land came together to really focus on creating a fitness zone. And if you all have a chance and you're on the main campus, it's on Madison Avenue between 102nd and 103rd Street inside Carver Houses. So if you've ever passed by, we had our inaugural opening ceremony in January of 2020. And this was a really great example of where we had a tenants association, patients, stakeholders, hospital system, public funding, private funding, and a housing authority to come together to have the first fitness zone of this kind and really work together to make this happen, looking at social determinants of health and environmental health at the same time. Next slide, please. Thank you so much for your time. And now I believe Devin will be taking over. Thank you so much.
Thanks, Crispin. So I'm going to take us on a brief journey into the world of participatory narrative inquiry, which is a relatively novel mixed methods approach to research that I've had the pleasure of discovering a little bit more about during my PhD studies. And I'm actually using this methodology to engage bisexual plus femmes in a participatory story sharing study on the topics of belonging and queer imposterism. So much of what I will share is within the context of how I am applying PNI or participatory narrative inquiry to that work. And this is just a flyer, a part of my carousel for recruitment. We can go to the next slide. Just so there is a little bit of context for my research, I was interested in learning more about queer imposter phenomenon. The term imposter phenomenon at this point is fairly ubiquitous, if not also a bit controversial. But I was surprised to find that despite people using it colloquially to talk about their identities, including their sexual identities, the term itself has come in the research to mean a very specific thing within inherently competitive settings like academia or the workforce, even athletics. It's not, to my knowledge, been formally studied within the space of bisexuality, despite many bisexual plus people, including femmes, noting in more mainstream media that they feel like imposters. So following the lead of those voices that were being amplified in the mainstream, I wanted to really conduct an equity-driven participatory study that would allow us to better understand what's going on. Why is this term coming up again and again? What does that all mean? And I found that PNI was going to be one of the best ways to do that and to make change. If we could go to the next slide. We're likely more familiar with the concept of narrative inquiry, which is the umbrella that PNI falls under. And I was drawn to this idea of using a narrative method for the research because of this idea that people are most used to sharing more about who they are, how they operate, what makes them tick, really through story. It's perhaps no surprise that I was also an English major during my undergrad years. But I do operate from this assumption and belief that we are at our most human and therefore perhaps our most honest when we're in community sharing stories with one another. And so given the vulnerable topic at hand, it felt like it would create a space where people could really come together and share authentically how they were feeling. If we could go to the next slide. When digging into it a little bit more, I was really struck by P&I because the approach allows participants not only to tell their own stories, but also to take a step back and examine their stories, to also work with other participants to help them examine their stories, to examine each other's stories in relationship to one another, and finally to examine these stories in relation to the research questions. But it really takes the researcher out of it and allows the participants to dig in, to look further, to explore more. Why am I sharing this story? How did sharing that story make me feel? Do other people relate to this story? Is this a unique story? And in true participatory nature, it is the participants who really do that formal analysis process together. The process is actually called sense making. We'll talk about it in a moment, but they get to decide this is what comes next. So if we go to the next slide. There are actually 6 phases involved in the P&I process. 3 of them are considered required phases and 3 of them are considered optional. That said, I found that working through building my study that each of these steps is actually incredibly rich and lends to a rigorous research process when done together. So on the slides, on the next couple of slides, you'll see an asterisk next to the phases that are deemed required. But again, like there's a caveat to that. They all seem to have a place to me. The first step is the planning phase, and this sounds like obviously it has to be required, right? But planning here actually doesn't mean planning as we have come to traditionally understand planning. It's not about building the protocol and making sure you get everything through IRB. Obviously, that's a part of it, but it's really about taking the time out as you're building the protocol to ask yourself questions or have someone else ask you questions that allow you to tell yourself stories about the project that you're engaging on and how it will go. This is called getting into the narrative mindset. By engaging in this activity, you're starting to think in story. And you start by doing that to notice the things that you might not have otherwise and to kind of get into the feel of what you're going to be asking your participants to do. The second is collecting stories. This can look a lot of different ways. For me, it's happening in group sessions where participants will share their stories with one another directly. I've listed a couple of the ground rules here. There's way more, but I'm just going to highlight the self-fulfilling prophecy one, which is that if you believe people will come to the space and tell stories to one another, they will. It's a sort of you build it and they will come mentality or belief that you have to really buy into to take this approach, and other people have to buy into it as well if they're going to show up. Another thing to quickly note here, though, is that this is a mixed methods approach, which I said earlier. So they're not just telling their stories and recording them and we're getting the transcripts and we're coding them. They're actually also filling out short story surveys about the stories they each shared, how they made them feel, where they think they rank in terms of universality. And it's kind of looking at that all together. The third step is a process called catalysis. Again, this is optional, but doesn't feel so optional, feels like a really good step to take if you want to engage really with the data. And this is done on a more insular level. This is when the research team kind of takes the data that they got from the story sessions and they go through an exploratory process. This is not meant to yield answers. This is not meant to be the analysis again. It is really just meant for you to be able to take a step back, sift through things, and come up with observations that you can then share with the participants to get them thinking more about what they're thinking through. If we could go to the next slide. The next step is called sense making. I think back one. Yeah, there's so many ways to do this. What's on the screen here is just the way that I'm going to be doing it for my research. But the key here is really giving people the freedom to reflect both individually and in group and play their way through the data to come up with final reflections. It's meant to be highly interactive, highly hands-on, pretty intensive, but absolutely doable, and gives the participants a lot of agency in the process to really get their hands in the data and come up with some reflections. Next slide. Here, I went ahead and merged the next two steps, which are return and intervention. The final step is really to return the results back to the participants and say, did I get it right? What's missing? What are your final reflections? And it's during this phase or before that you can also work with the participants to identify what is called in this process intervention, but basically means like action, what comes next. So going back to some of the thoughts of participatory action research, it really gets the folks thinking about, okay, we did this work. Where do we want it to go? Who do we need to see it? How do we want to put it out into the world? They really get to decide what dissemination looks like. Where does this grow from here? And then you also do a bit of processing of the actual process with the participants. And the final slide is just to leave you with some resources. Honestly, all of these are from Cynthia Kurtz, who I'm unofficially dubbing the fairy godmother of this method. People have been working with similar approaches for years. Cynthia definitely gives them credit, but she did write the book on PNI. She has a blog on PNI. She wrote a follow-up book on PNI. She has a practicum on PNI if you're interested. And she even built her own data repository and web application called NARA Firma to support researchers through this process. So if you're interested in this at all, highly recommend you check her out, and also would be very happy to talk about this further with anyone. And without further ado, I'm going to pass it on to the next panelist, Reverend Mimsy Robinson, who's going to talk to us about the value of stakeholder engagement in research. Go ahead.
Hello, everyone. It's a pleasure to be with you today. And I am indeed privileged to be with all of these fine researchers. I'm privileged of knowing most of them from many projects. You can go to that next slide, which kind of gives people an idea of just some of the stuff. And this is not everything. I know some of you who I work with say, wait, where's mine? Yes, there are things missing, but this is just to give people a taste of the many opportunities that I've had to serve. And I really see it as an opportunity to serve. Again, I'm not coming with all of the different, if you will, names. I think all of these fit under community-based participatory research, if you will. I think ultimately that's what we're talking about, in many different ways to approach that. But what I want to say is I think that there's great value to stakeholders being involved in research. And I think what all of us are saying in a nutshell, first of all, how do we keep community health research about the community? I think that's really where we're headed here. We want people to be meaningfully involved. We want partnership. In essence, we want to keep the main thing, which is about lives being changed, positive outcomes when it comes to health. Research, as you know, can be cold and calculating, numerical and statistical, but by engaging community partners, I think we can ensure that it remains humane, balanced, and most of all, helpful and practical. And so with that in mind, it might not always be the most efficient way to do research, if you will, when we talk about CVPR or other methods. But, you know, I mean, there are deadlines. We know that there are all kinds of things to do as part of their jobs. But when we do this kind of work, when we see the change that can come in lives, when we realize the lessons that can be learned by both researchers and the community in the process of these partnerships, I think we realize that we're on something very, and use that word in this context. Let's go to the next slide, and I will share with you, as we talk about the value of these kinds of partnerships, using an example. I've got so many mentors and friends. I guess I have to give a shout out to Dr. Carol Horowitz, who I saw, I don't know if she's still with us. Got to give a shout out to Dr. Zorina Costello. She's on. She's definitely been someone who, in the more years, I've connected with on several projects. Getty, high five. Devin, high five. Nita, high five. Nita's been a wonderful, again, PI for, again, youth-based version of the HE, as she shared earlier, and I love working with her on that. But this particular project came out of a project. Interestingly enough, it seemed like we were trying to find our footing with CARP, which stands for the Community Academic Research Partnership Board. And long story short, when Dr. Erwin Bottinger came to us, as stated here, a community naive researcher, and began talking to us about APOL1, which is a genetic variant. In essence, I think we start to find our footing, and we formed a separate genetic subcommittee. We became an independent board. And when we got into this, there was a genetic ethicist, as you can see. It makes me think about MC Hammer. Can't touch this. Don't touch this. You'll set the disparities movement back 30 years. Why? Because it's genetics, and you know, eugenics, all of those things that come from the past. People wonder whether this can be done in a way that is just, equitable, etc. Dr. Carol, who I mentioned earlier, she said, now maybe white doctors won't judge Black people analysis as not being compliant. They'll recognize that there's more to kidney disease than bad behavior. In other words, there's a genetic basis. Let's go on. As mentioned, APOL1 is found in 1 out of 7 African American. And so we structured a project, which I'm not going to get into all the depths of in this conversation, but in short, that project proved there is a genetic basis. More when people are aware that they have this APOL1 variant and they manage their blood pressure, it might keep them from developing chronic kidney disease. And so that's, in short, what this particular study focused on and helped people get their head around. Important pieces that came out of that research. The board co-developed recruitment strategy, and this was critically recruitment felt like it was from one of their neighbors. So when people were dealing with one of the team members, like they were talking to family. And that's important when we talk about these kinds of projects that are community-based. They have to feel the community is indeed engaged, and like the community is indeed taking charge of their own health, which is extremely important as we talk about community-based participatory research. Recruiters, again, community and of the community, and develop relationships with the community. We can go forward to the next slide. The impact of the study led the board members becoming co-authors, co-presenters, important meetings of researchers, and I loved it when community people kind of, I'll say, crashed many of those scientific meetings, because those scientific researchers, who I believe are good people, you know, sometimes you can get kind of lost in the sauce. You're so busy doing what you're doing that you forget why you're doing it. But having the community show up at those meetings help people realize why they're doing what they're doing. Began sharing narratives, as we talk about narratives, experiences that they've had, even those researchers, about why they became researchers. Again, we have to keep the main thing the main thing. The main thing is helping people. The main thing is making a difference and having positive health outcomes. And when we work together and walk together through these things, we can see that in a far better way. So again, we've seen that the things we've done have led to other projects. Dr. Emir Kenny, she was able to get a Caesar grant forward in research that's made a difference in the lives of many children. And again, we go on. We can go to the next slide. There are many lessons from the process. One lesson we learned, we need to be vigilant. The research should proceed, but carefully. We talk about genetic research. Yeah, there are some real issues. There are. The board views race as a social construct, but we recognize that ancestry has biological and genetic components. One can't get around those realities, especially as we talk about precision medicine and the fact that you could leave out a whole, just hordes of people with this new and better healthcare if we don't look at these issues. It's better to be at the table than on the menu. Obviously, being able to weigh in, give opinions, can make a difference because we can balance the product, the research, far more balanced, far more effective for a lot more people. How do we advance science in a good way and not take advantage of the vulnerability of the community? And these are realities. There are vulnerabilities that many people of color have in terms of the community, the financial vulnerabilities, socioeconomic challenges, all these are realities. The statement that looking at genetic risks by ancestry works against our community is traditional and stereotypical. Our work illustrates that genomics can be integrated into community health. Absolutely. Many lessons, other lessons, if you will, that were learned. You can go to that next slide. Tim, the culture of understanding is far more important than the culture of fear, and the culture of understanding has no color. Our came from willingness, ability of all stakeholders. In essence, everyone's a stakeholder when we think about it, to challenge their views about race, racism, ancestry, genomics, and we developed a shared language. We use our understanding to change research dialogue, language, and strategies. In other words, the boilerplate consent forms of the IRB were changed to be more sensitive and instructive, etc. Just an example. We agonize about making sure everything we do and provide and guard the study gives other patients that we're not the ivory tower. Let this get messy. It will. Researchers ceding control is a key to communication and innovation. We can't hide behind our titles or hide behind our accomplishments. We've got to be willing to do some things that might not be comfortable and might not be easy, might take more time, but we'll get a better product. This voice needs to be harnessed. People will become engaged when someone who like them is at the helm. Precision medicine earlier. Precision medicine can't be about a subset of the population again. If it's going to benefit any people, it ought to benefit all people. We go on as we move toward our conclusion. How do we foster a culture of understanding amongst researchers and community stakeholders? First of all, accept the fact that new collaboration will be uncomfortable at first. And I'll add to that, it might get uncomfortable later on too. That's all right. We can learn. We can grow. That discomfort. Privately examine your own feelings, thoughts, experiences, hang-ups, prejudices, we all have them, and determine not to let them get in the way. We've got to break. We've got to be transparent in your discussions with your research team about the aspects which you still struggle with, and give permission to others within the group to ask how these issues might influence research decisions. Undoubtedly, they do.
Reverend, I'm
Yes.
sorry to interrupt, but we're like almost out of time and we need to go
Okay.
to our question and answer. Can you kind of wrap it up for us?
We're wrapping right now. So make every effort to develop a diverse researchers, clinicians, patients, and community stakeholders having representation from several racial and ethnic backgrounds. And finally, seek to maximize the collaboration between the researchers and the community by building capacity, reading, videos, and virtual or in-training. Please stop.
Thank you so much. Thanks to all of our presenters. It's clear to me that we could use 1 hour for each of you to share your experiences, your expertise, and to help, new researchers to make decisions about where they want to go. Do we have some questions Timney, anyone have a question that you'd like to ask? Well, I'll start with a question, which may apply to some of you that are beginning to do some research. How do research teams identify which community engaged approach works best for their research teams? Would anyone like to share your thoughts about that question? Don't be shy now.
I can just say that when I think I talked about this a little bit in my slides, but when I was thinking about the topic at hand, the research questions I had, the kind of information I knew I wanted to get, and the type of environment I wanted to build, the goals of like really creating an equity-driven space, I knew it had to be participatory. Part of that was like I've been mentored by Dr. Carol Horowitz, by Dr. Neeta Van-Purim, by so many people that we all know and love. And I couldn't not do something that engaged participants in the process. And then when I started to think about narrative inquiry and this idea of storytelling and story sharing and the way people communicate about their identities, it just kind of came to life. Some of it was also informed by the theories that I was looking at that were backing my research. So I've been working with like social identity theory, compulsory heterosexuality, and those theories also lent themselves to a narrative approach. So it all kind of just aligned for me in terms of which participatory approach made the most sense. And I also wanted something that was going to be high on the active angle. So thinking through next steps and thinking through moving to action, which most of these engaged research methodologies are. But I liked the process that this one took to get there.
Yeah, it seems like you get more qualitative information. And in the process, you help people to better understand themselves, right? One question that I think is pretty common is, how do you build trust with communities when you're initiating a research project? Anyone want to take a stab at that?
It's highly relational. First of all, trust has been broken. First, that's to be stated. It's been broken by countless things, which many of you know of throughout history, from the standpoint of health care and mismanagement of health care or people. That having been, each of us have to start at ground level when it comes to building that trust. It will take time, but becoming a friend. I'm again looking at Dr. Horowitz in a box not far from me over here. She's become a friend. Looking at Getty, you become a friend. I'm looking at Neeta, you become a friend. Devin, oh, you friends because I spent time with you, and you're real people, and you were willing to keep it real. Dr. Costello, willing to keep it real, and willing to open up your lives and just, again, care enough.
Thank you, Reverend. Thank you. Let's go to Dr. Horowitz, who has her hand up.
Thank you for this really wonderful presentation. It's such a pleasure to learn from you all. As research changes, people are doing a lot more research on things like using big data and machine learning and genetics. I think a lot of people, when they think about engaged research, think about more things like qualitative research and chronic disease prevention and control, which are really important. I was interested in how you all feel about a pivot to having engagement in all research, including things like basic science or machine learning or genetics. How do you see that as different? And do you see the way you engage people as different, or is it just an expansion of what you already do?
So thank you, Carol. I'll take that question. And so I think there are a lot of efforts, and there's a great group that we're working with now through PCORNet, the Patient-Centered Outcomes Research Institute network. It's a data network of different sites from across the country. And we're working exactly on looking at big data. What do those outcomes mean? What does it mean for communities? also a really interesting conversation came up recently on how AI is having an influence in certain therapies and how people can be involved. And we're getting a really overwhelming response from various stakeholders, diverse stakeholders who want to be involved in these conversations and want to have skin in the game. And so I think it's just a matter of prefacing how we continue to build trust, especially in areas that are kind of uncharted in the research world.
Thank you, Crispin. Did that answer your question, Carol?
Yes, thank
Anyone
you.
else? Okay, great, thank you. Seems there's a couple of questions in the chat. Devin, this question's for you. It seems that P&I can have a secondary or unintended impact that is cathartic for participants to engage in this work to make meaning of their experiences. Have you experienced this? If so, is this a part of the documentation or return/intervention stage?
Yes, it is. So during that return intervention stage, there is like a bit of a process evaluation that gets done to really understand some of those more personal benefits that people experience, and also just some better understanding of what going through that process was like for a person, even if it wasn't beneficial. Maybe it was hard, maybe it brought stuff up. Getting to know some of those perhaps not direct intentions, but unintended consequences for good or bad, for better or worse, from the participants' perspectives is really important. But I think part of community engaged research, one of the things about community engaged research that is really cool is that there are always going to be some sort of secondary or unintended impacts. You're building skills, you're bringing people together, you're having them really like develop this new sense of agency over this scientific process. So I think we have to do a better job in this community in general of understanding the impact of community engaged research on the people who get engaged. And I think that's something that a lot of us are grappling with right now. So it's a great question.
Great, thank you, Devin. That was from Sophia. We have a question from, I may pronounce this incorrectly, Olade Williams.
Yes.
And this is for Nita. Apologies if he missed this, but how were the youth that were involved in the creation of materials and recruitment trained? Is there a standard practice for teaching youth these practices? And also, how only were the youth involved, and how young could something like this go?
Oh, thank you so much for the question. You know, in our case, I think, and Getty and Reverend Mimsy can chime in because they were also involved with working with the young people. In our case, it happened quite organically. I think, you know, it took time. I think the young people, in the beginning, they were quiet at meetings and they kind of listened more than spoke. And I think it took some time to develop the comfort and to sort of mentor them in what it means to kind of shape research. So in our case, I feel like it evolved over time, and with that growing trust, relationship building that Reverend Mimsy mentioned, the comfort grew, and then their voice was amplified more and more to the point where now this work is almost entirely youth driven, and you know, we have some seasoned community researchers who are here who are still involved, but a lot of the young people are driving it. So we didn't actually use a lot of a formal curriculum. It really came more for what is going to resonate with people like you and just believing them, you know. So like when they said, you know, we looked at a lot of slogans. I don't know if you all remember the votes that we did on those, but you know, the older board members put some stuff out and the young people were like, that's not going to work. We have to use different words to talk to young people. And so I think it was just putting trust in them and making sure that their voice was really heard and valued. That being said, the YPAR curriculum that I mentioned from Berkeley is a more standardized curriculum to kind of teach youth skills for, you know, using research to drive change. And so I think it's a wonderful resource that can be adapted for research like this. But I'm happy to talk offline as well if you'd like to talk more.
Yeah,
think
thank you.
I
Thank
think
you,
she also
Nita.
had ages, and these were so they were, you know, pretty sophisticated teenagers, just for the record. And I think they felt that they could be themselves. Long story short, I don't know how it would work with preteens or younger.
Right, yes, the
Cap was, I
age,
think, was 13, wasn't it?
yes,
I think
thank
they
you.
were as
Chris.
young as 13, but most
Oh,
of them.
wow.
Yeah.
I think, a little- yeah.
Yeah,
Okay.
it started at 13. It was wonderful. Zarina, are you asking the name of the teen curriculum?
Yes, I couldn't hear it exactly. Oh, I see. Okay.
YPAR,
Thank you.
yeah.
Thank you very much.
Yeah, youth power.
Right. Any other questions? You know, the most important thing in this type of research is basically to involve the community. The sooner the better, you know, because people in the community oftentimes feel that research is being done to them and not being done as a process that can help them. And so, you know, the sooner you can have people involved, the better.
I'll make a comment, and my comment is that I think as in understanding this type of research, what happens, again, I've been spoiled having, you know, incredible people like the ones who are here, already mentioned, you know, Doctors Carol Horowitz, Dr. Costello, you know, all these who were on today's panel. They made it easy for someone like myself who did feel uncomfortable coming into a situation like this to feel at home, and not just, but to feel like a member of the team. Again, you know, and Dr. Vanjipuram likewise. Again, if you feel that way, makes you give your best. If you don't feel that, you eventually look for the exit. That's the truth.
Right. And, you know, one thing that is very helpful is for both groups, the community and the researchers, to have mutual respect and to accept that the community knows the community and the researchers know research. And once you can like get to that place, everything is really going to be very valuable and important. We have 1 more minute. Anybody have a last question that you'd like to ask? Well, I'd like to thank our presenters again. Wonderful, wonderful stories about research and the work that you've done. So incredibly valuable. We'd love for you all to complete the brief feedback form so we can continue to make things better in these presentations. These are going to take place every other month. The next one will be January 31st from 1 to 2. So thank you all again and happy holidays.
Take care, everyone.
Everyone.
Also, feel free to connect with us and send us an email. We also have community tours and consultation services. So please feel free to reach out. Thank you.
Good job, everyone.
Okay, I think we can stop the recording, and I think we have a SEAL meeting on a different line.
Okay. Well, I'll see you all later then.
Thank you, everyone. Good job.
Thank you. Bye.